Cancer is one of the most feared diagnoses. But what if we told you that up to 95% of cancer cases are actually driven by lifestyle, not genetics? Today's guest is here to shed light on this often overlooked truth and empower you with real, clinically backed strategies to strengthen your body's natural defenses. In this eye opening session, we'll explore the biggest myths about cancer and why it's not just genetic, the hidden contributors to cancer most doctors don't talk about, how diet and lifestyle play a massive role in prevention and recovery, the key foods that increase or reduce cancer risk, and what you can start doing today to build true cancer resistance. So get ready to rethink everything you've been told about cancer and learn how to take control of your health, starting now. Welcome to the Heal Deal Podcast. I'm your host, Dr. Leona Allen, and I'm here to help you achieve more freedom in your health and your life. I'm the founder of Freedom Health Systems, and I've been a licensed chiropractor and wellness coach for over 2 decades. I've helped men, women, and children transform their lives by removing the physical, chemical, and emotional barriers to natural healing. Every week, I'll be taking you on a journey where you will discover the real truth behind what it takes to heal your mind, body, and soul. Allow me to be your guide as you travel this road to renewed health and a new life. It's time to make a deal with yourself to heal yourself. Please keep in mind that this podcast is for educational purposes only and not to be used as a replacement for medical diagnosis or treatment. With that said, let's begin. Dr. Michael Gaeta, now you're a practicing dietitian, nutritionist, herbalist, and acupuncturist with over 35 years of clinical experience in Chinese and natural functional medicine. And you've also helped thousands understand the profound connection between diet and disease resistance. But before we get into our topic today, please share your story and of how you got into this work of practicing and teaching natural functional medicine.
Well, thank you, Dr. Allen. It's great to be with you. I appreciate the invitation, and I'm really glad to be hopefully sharing some useful ideas with your audience. My first career was in music. There's my piano back there, and overlapping with that, as a musician, I realized there was more I wanted to do, and then found my way into school for massage therapy and nutrition and herbal medicine, and then continued on to acupuncture school. And it's just been a wonderful journey. And I realized that there was more for me to give. And so I started teaching about 3 years into my practice. And now I'm kind of teaching full time and still see patients around the country on Tuesdays, usually virtually, and also here in Colorado. So it's been a wonderful journey of being able to help people, because I think what's really needed and what's happening, and I'm sure you see this too, is we're experiencing a culture shift towards a new default lifestyle of nature first, drugs last, as opposed to all drugs all the time, which is, has been the predominant model. People want something more than that, and they realize the limitations of that, and they're looking for a natural approach to get well if they have a health issue and to stay well if they're already healthy.
That's pretty fascinating. I love how you have that music connection. That's kind of cool. So, from music to what you do now and integrating all that good stuff. So somehow, the reason why I'm bringing that up, we'll get into the topic, but
Yeah.
I love to dance and I try to incorporate
Oh,
dance in, what I do.
wonderful.
So it's
Oh,
kind
that's
of
great.
fun to have that fun connection inside our
Yes,
real technical stuff that we do. So I
that's right.
found that pretty awesome. So, in our topic today, we're going to link. I know you're just so brilliant in so many aspects of health, but today we're going to really dive into cancer. But, and it's such an important topic. So, when you accepted my invitation to be on this podcast, I was thrilled because I definitely wanted someone who was an expert in cancer in relation to the environment, lifestyle, and diet, and things like that. So, how did you become interested and in this topic, first of all?
Well, yeah, as many of us have come into this field, sometimes it's been through difficulty and challenge. And for me, I was just 3 years into practice. It was 1993. And my best friend and mentor, my first mentor, other than my dad, was diagnosed with cancer. And I was just practicing a few years, hadn't really seen that many cancer patients, and I didn't know what to do. And here was like one of the most important people in my life dying of liver cancer, and I just felt helpless. I'm like, I know this type of natural health care can help people who have cancer, but I just didn't have the knowledge or the skills at that time. This is my 35th year of practice, and that was 32 years ago. So I was really not really well versed or trained in natural approaches to supportive care. And so when he died, it was very difficult for me. And I was just 20 something, in my early 20s, and it was difficult. And that experience of, was the first kind of close to me death, and in terms of a friend or family member, that I, in my adult life at least. And I decided at that time, from that very difficult experience of losing my mentor to liver cancer, or perhaps more accurately to chemotherapy, that I wanted to really get good at this area so I could help people. It's too late to help Brother Ron. It was Brother Ronald Marcelin, who was a guidance counselor at my high school in New York. And he, was a huge influence on me, really helped pull me out of a very dark time in my younger years. And I realized it was too late to help him. He had passed, but it wasn't too late to help other people who wanted to prevent cancer, or if they had cancer, to use a natural approach alongside their conventional treatments, whatever they're doing, to help support them, reduce side effects, improve quality of life. Maybe they even live longer, but just to really help them in with their cancer process.
Are you doing everything right, but still battling fatigue, brain fog, and weight that just won't budge? Here's the truth. It's not your willpower, it's your metabolism, and I can show you exactly how to fix it. I just released a free breakthrough training that reveals why 88% of Americans are metabolically broken, and the three-phase system that reverses it. If you're ready to stop spinning your wheels and start seeing real results, go to beginhealingtoday.com. Again, that's beginhealingtoday.com, and you'll also find this link in the description. Now back to the episode. Yeah, I have a pretty similar story as well. I mean, you said this was over 30 years ago, and we're going to get into the details, and it's like the rates of cancer have significantly increased. But my mom, when cancer got my attention was when my mom passed in
Oh, wow.
2014.
Oh, sorry.
Yeah, and that's what opened my eyes to, oh my goodness, there's something going on, because my mom was considered healthy. She didn't have the symptoms, and she did what she could to be well. And she had breast cancer and passed in
Oh, wow.
2014. So
Oh,
that's
wow.
what caught my attention as far as cancer and how to manage it. And then that was in the beginning of my healing journey, pretty recent in practice. And my regret is I wish I had known what I
Yes.
knew now.
Right.
And it
Exactly.
turned out that this is something that's been going on in her system for years undetected. And then when I finally got on my journey and started looking at my health, and you said that your mentor had liver cancer, and I sincerely think I was on my way about 10 years ago, knowing what I know now. I probably wouldn't be here. I probably would have had liver cancer if I didn't know what I know. So I had liver disease, gallbladder disease, pre-diabetic.
Oh,
Yeah,
wow.
that was my
Okay.
recipe. So
Well, it's amazing how we come to where we are,
I
and
know.
we learn what we learn when we learn it, and and life shows us the way somehow.
Yeah. Now you understand why I wanted you here today, not just for
Yeah.
my personal reasons, but I know a lot of people can benefit from this information.
Well, then I'd like to dedicate this
Yeah.
time to your mom,
Thank you.
and also to my friend Brother Ron. So
Absolutely.
we'll have this time in honor of their memory.
Let's do it. So
Wow. Wow.
yeah.
Okay.
So it really opened my eyes to what cancer really is. And you're going to really talk about when you understand what it is and how it can be avoided or prevented, it doesn't seem, I guess what's the way to say, it doesn't seem as threatening, I guess. It is preventable, but I think when people hear the word cancer, they think, "Okay, that's it. There's nothing I can do." But this
Right.
conversation is so important because I know you're gonna help people reevaluate or redefine what cancer is and how to, manage it or prevent
That's
it.
right. Yeah,
Yes.
it's a good point. Yeah, I was driving to, I was trained at the New York College of Health Professions in New York and taught there for 10 years. And I was driving to school one night to teach class in Chinese medicine. And it was on national, I was listening to National Public Radio on the Northern State Parkway in Long Island, headed out to teach this class in Syosset. And there was they had the head of oncology at Stony Brook University Teaching Hospital, which is a major, medical school and teaching hospital in Long Island in Suffolk County. And he was being interviewed by this NPR guy, and the NPR interviewer said something that I think most people believe, which is that cancer is in your genes, and it's a genetic thing. You can't do anything about it. It's just going to happen. It's in your genes, and you're going to get it. And the doctor says, head of oncology, he said, yeah, that's true about 5 or 10% of the time. And it's pretty hard to like stun an NPR interviewer into silence where they don't know what to say. But there was this long kind of pregnant pause on the radio where it just, you can kind of, I can kind of feel him getting unplugged from the matrix a little bit. And where this is a completely new perspective. So finally he recovered, realized he was on the air and said, wait a minute, doctor, do you mean to say that 90 to 95% of all cancer cases are lifestyle and not genetic? Like it's in your genes, therefore you get it. He said, that's exactly what I'm saying. 90 to 95% of all cases of cancer are, you may have a genetic predisposition, but whether it happens or not is not in your genes, but in your lifestyle. And then so that the conversation just went in that direction because the interviewer was just stunned, and it completely shifted his paradigm. And it's really true. Even the National Cancer Institute, which has pretty significant connections to pharma, acknowledges that at least 2/3 of all cancer is lifestyle. I think I'm more with that oncology guy, where it's probably quite a bit higher than that. But yeah, people need to understand, Leona, that this is a preventable and in many cases, or at least in some cases, reversible condition that is generally based in the lifestyle. In other words, things we can change, things we can make different choices about. So, as a holistic, practitioner practicing Chinese and natural functional medicine, I'm not treating the cancer. That's the oncologist's job. I'm treating the patient and seeking to increase their natural cancer resistance, which is really the best possible solution to a cancer diagnosis, is increasing your own body's ability to throw off or resist that cancer, so that it is reduced or cleared or eliminated or prevented if it's been removed or whatever. But it's all about, from the holistic perspective, increasing our body, mind, our own cancer resistance. And we can do that very significantly through diet, among other things, which is our topic today.
Yes, yes. But before we dive into that, it's so important. I want people to understand. I mean, they hear the word cancer. Can you, and I know you said it was a lifestyle thing, but when you hear cancer and someone says, "What is cancer?" How would you answer that question?
Well, cancer is, you can describe cancer accurately as, well, it's kind of a generic term for more than 100 different diseases that can affect any part of the body. So you can think of it as a systemic genetic disease. So there are aberrant cells that start to multiply, and their sole job is to multiply. Kind of like viruses only have one purpose, which is to copy themselves. Cancer is the same thing. So if you think of growth, how cells divide and replicate, there's a green light that says go, copy yourself, and there's a red light which says stop, don't divide anymore. And cancer, interestingly, has the ability to kind of blow through the stop sign ignore the natural the natural stop sign to end copying or replication. And even worse, they have the ability to create their own green light that didn't exist otherwise, or they create their own growth signals, and they can ignore or resist anti-growth signals. And so the three main features of cancer, like what makes cancer cancer, the first thing is what I just said. It's aggressive. In other words, it divides, and these cells grow and divide without respect to normal limits. The second is that it's invasive. Now, it can invade the cancer cells can invade local cells and tissues and organs. And so, for example, prostate cancer will often spread to the bone, just as an example. It's a nearby tissue. In the pelvis, the prostate cancer will go into the bones of the pelvis, for example. And then the third characteristic that makes a cancer is that it's metastatic, meaning it can spread and set up shop, so to speak, in other parts of the body, far away from where it started. So these are the three properties of cancer that makes it different than a benign tumor. You can have a mass, which is benign, and it's not going to be aggressive, it's not going to be invasive, and it's not going to spread or be metastatic. It's just going to sort of sit there. And that's certainly less dangerous than what will be, say, a cancerous tumor, for example. So that's basically what cancer is. It's this generic term for a whole bunch of conditions that are systemic genetic diseases. And the big question is, why is that happening? Why are there alterations to cellular DNA that allow cells to grow themselves, copy themselves without normal limits, and create their own growth signals, and to evade the body's defense mechanisms? And on top of that, they can create their own blood supply. We call that neoangiogenesis, where they'll actually stimulate the formation of new blood vessels just to feed themselves more nutrients. And they'll just keep using up body resource until the body is exhausted. And then you end up with multi-organ failure just from use of resources. So that's, sort of what makes cancer cancer, and how it's different than, a benign tumor.
Okay. And I just wanted to, I'm just trying to think of the ears of people listening to this, because I know they're getting mammograms and getting tested, and they're told stage 1, stage 2. But they're not really told about the triggers or what's really going on. They just hear, oh, I got stage 1. I have a lump here and there. What do those types of things really mean? Because sometimes I hear it and I'm like, well, that doesn't mean it's cancer. It's, what I mean? So how would I'll let you explain it, because I have my thoughts.
Yeah, sure, sure. Well, yeah, I mean, the increase in screening has led to earlier diagnoses, which then allows them to get more easily to the 5-year mark, which is considered cancer-free. If you survive 5 years, that's considered resolved. But the issue is, first of all, things like mammograms, that's a form of X-ray radiation, can be potentially cancer promoting themselves. So you have to make sure that the screening test is not going to make things worse, right? We see this with PSA, prostate specific antigen blood test, in men. And they've done an enormous amount of research on this and found out that regular PSA screenings actually worsen outcomes because men get overtreated more invasively than otherwise, and they actually have poorer outcomes. So starting in 2012, they changed the guidelines to not recommend routine PSA screening for men because the outcomes were actually worse. They were getting more biopsies, more surgeries, more drugs, more procedures, and it really wasn't extending life. And so, unfortunately, in our current broken medical system, as you know, Dr. Allen, is that it's a wait and see, right? Wait and watch, watchful waiting, whatever you want to call it, until it gets bad enough to intervene, which is not a very good approach, because the best time to treat something is when it's little, when it's early. Early treatment, especially when it comes to cancer, I mean, prevention's best, right? As Ben Franklin said, an ounce of prevention's worth a pound of cure, right? Even in today's economy. And so that's the best. It's better to prevent than treat. That's one of the principles of holism is preventative care. But then there's also early treatment. And well, let's keep an eye on it. I'll see you in a year. You're losing, golden opportunity to help the body resolve that early something, whatever it is, dysplasia or whatever. And you're just waiting until it merits an invasive intervention. That's not a great strategy. So I think, the other big thing in our broken medical system is that there's really no attention paid at all to prevention, right? There's just stop smoking is about as much as you'll hear about cancer prevention in conventional medicine. So, that's not ideal because there's so much we can do naturally to prevent, meaning increase the body's cancer resistance and do early, help the body in a very specific way. And we're not treating the cancer, we're treating the patient. But if we can treat that patient in an early stage of something, to help them heal themselves, improve their own ability to increase their own cancer resistance, their ability to throw off cancer, then you can have an amazing outcome. I've seen this happen countless times over the years where something was found early. We were able to give that natural supportive self-repair care, and the cancer went away, or whatever it was. The early something went away. So that's a very different perspective than, well, let's just keep an eye on it till you need surgery or chemotherapy or radiation. So that's a very big difference between the holistic perspective and the kind of conventional medical perspective.
So with that conventional perspective and people, early diagnosis is huge. Hey, get your yearly exams. But how many people are still dying per year of cancer,
Well,
despite
right. That's a good question. So we're getting American Cancer Society. This is some year. I think it's 1.7 million cancer-related deaths per year, according to American Cancer Society. Average age of diagnosis is about 67, although that's been dropping because of the explosion in very aggressive, we call them turbo cancers, which possibly are related to COVID injections. COVID injections have been catastrophic, at least 17 million killed worldwide, with really very little, if any, benefit. The harms are outweigh the risks, and we're seeing an explosion in turbo cancers or the recurrence of old cancers much more aggressively, and cancers in younger and younger people. So this sort of average age of diagnosis, 67, was pre 2021 when the experimental injections came out. So it's the number one cause of death in the U.S. is the medical system, killing about 1 million people a year is the estimate. Number two cause of death is cardiovascular disease, about 850,000 deaths a year. And then number three cause of death is cancer, which is about 650,000 deaths per year. Interestingly, in Canada, cancer is number one. Anyway, and worldwide, cancer is kind of competing with cardiovascular disease overall for number one cause of death. So it's a pretty big deal. And, there's certainly been advances, and I'm not against doing screening tests and, never do screening. I'm not saying that. But I am saying that we've got to pay much more attention to the cause, to the contributors, because we really don't talk about single causes in holistic medicine or holistic health. We don't look for single cause for single disease. We look at contributors, which are typically in the lifestyle, and there are typically several. So that's where we can do a much better job, and that's one of our topic today is one of those areas, which is how is our diet affecting our cancer risk? Because there are very specific foods that can reduce cancer risk or increase cancer risk, and that's where the action is how to help people become more resilient and cancer resistant.
Yeah, you did a real great job really setting the stage so people can understand. It's not always a life sentence. As long as we understand what it is, what triggers it, And I love that we're going to talk about diet because that's one of the main things that we can control the most. And it's a great place to
For
start.
sure.
So let's go
Yeah.
ahead and get into some of these foods that are actually contributing to this cancer crisis.
Yeah, as the saying goes, you can pay the farmer now or the doctor later, right?
Hmm.
So let's pay the farmer now, and
Yes.
preferably a local farmer who's producing your local organic foods when possible. Let's pay them now so we're not going to have that medical bill later on, right? So let's prevent rather than treat.
Yeah, I know I
That's
do.
always a better, right? All right.
Yes.
So yeah, and the other thing that's happening, just so folks are aware, that there's a real renaissance happening in oncology, and this surgery, radiation, chemo triad, which has been dominant for decades, is changing, and there's a real renaissance related to immunotherapies, which are usually immune checkpoint inhibitors that sort of deletes the red lights and stop signs on the immune system, so it just goes. Imagine you're driving, you have a brake pedal, gas pedal. This just eliminates the brake pedal, so you only have gas, and the immune system is just on go. And then it amplifies the immune response to that cancer. So President Jimmy Carter, who just passed away recently at the age of 100, I think it was about 15 years ago or so. I have to look up but it was many years ago, where he was given a couple of months to live with inoperable brain cancer. He went to Germany, got immunotherapy, and lived another however many years. It was over a decade after his diagnosis. The brain cancer was gone in 2 months. So immunotherapies, again, it's not perfect. It has side effects, doesn't always work, but it's similar to the holistic approach in a sense that we're improving the immune system function. So the immune system is in a better place to hunt and find and destroy cancerous and precancerous cells. The other thing, so that's a big deal. And the other thing are what's called targeted therapies, which are drugs that are selectively toxic to specific cancer cell lines. So you have much less collateral damage from that. Now, immunotherapy, since it amplifies the immune response, you have a greater risk of autoimmune disease, which is often triggered by, or part of it is, and maybe that's another conversation about autoimmune disease, but heightened immune reactivity and activity is a part of one of the contributors to autoimmune disease. So anyway, immunotherapy, target therapy are, so my reason I mention them is that anybody who's been given a cancer diagnosis should ask the oncologist if immunotherapy and targeted therapies are available for their exact type of cancer. Because there's many different cancer cell types. So when you say, like your mom, breast cancer, I believe, right? So there's many different types of breast cancer. And for some of those, there might be a targeted therapy available, which is selectively toxic to that type of cancer cell. So anyway, this is all like a renaissance that's happening now in oncology. And anybody who's given a diagnosis should just ask, hey, doc, our immunotherapy and target therapy, is that available for my condition? And sometimes it is, sometimes it isn't. But it's interesting. It's a little bit, especially the immunotherapy, is very similar to what I've been doing for 30 years in working with cancer patients, is to help their immune system work better. So anyway, just a little note on that. So let's get into diet. And it's interesting, this whole understanding of diet actually was first acknowledged in the 1950s, with a relationship of diet to cancer. So it was later on, it was in the 1970s when we had the beginning of GMO, genetically modified foods. So this was before that, but it was even known in the 50s that diet has a relationship to cancer. The famous physician, Albert Schweitzer, traveled the world and realized he was a missionary in the 1930s going around the world. And he found in native populations all over the world, and Weston Price, who's a dentist, found this as well, where people were eating their traditional, ancestral, Aboriginal diet, and they did not start eating civilized foods, I guess we'd say, processed, refined, packaged, foods. there was almost, if there was zero or very little cancer. For example, he told a story of he went to the Swiss Alps, and in the upper valleys of the Swiss Alps, where people were eating their ancient diet of like sourdough bread and raw milk, for example, they had very little, if any, cancer. When they built a good road and brought in the modern foods, the processed, refined, adulterated, packaged, processed foods, for the first time, they had to build a hospital to treat the cancer patients. Like there was no cancer in those regions until they built in a good road and started bringing in, foods of commerce and civilization, the foods that we're used to eating. So, and this has been true like all over the world, Native American populations, Eskimo populations. It wasn't until they brought in these modern foods of civilization, what he called civilized foods, there was really very little cancer among the natives in those regions. So Weston Price found that as he traveled around the world. Dr. Stephenson, Albert Schweitzer, all these guys found the exact same thing. And then there was a study done back also in the 1950s, and they had two groups of test animals. One was on like a modern processed food diet. The other was on a more natural, unrefined diet. And they injected cancer into all the test animals. And 90% or more, 90 to 100% of the animals eating a natural foods diet were able to resist the cancer. They never developed cancer. Whereas the ones on the refined diet, most of them died of cancer and they developed tumors. So their diet made them more resistant. And it's interesting that somehow they did a human experiment on this in a prison. These prisoners in a Pennsylvania prison volunteered for this study. And they had one group of them on whole foods, the other on refined foods. They injected all of them with cancer. They volunteered for this. And it was a similar idea. It was the ones who were on a highly deficient diet developed cancer, or the one on a whole foods, unrefined diet were able to resist that cancer. So it's very interesting. So next I want to talk about some of the foods that contribute to cancer. Now, and then we'll talk about foods that increase our cancer resistance. So a couple of things that we need to be aware of in terms of our diet. The first thing we have to mention is sugar. In the 1800s, average sugar intake per person was 2 pounds of sugar per year. Today, the latest data we have, which is from a little over a year ago, is the average American today eats 102 pounds of sugar per year. That's 4.5 ounces of sugar per day. That's not good. As you might imagine, that's a problem. Cancer thrives on sugar, and that's the basis of the PET scan. Positron emission tomography is where they'll inject you with a bolus of radioactive sugar and just take a picture of you and see are there any areas where the sugar is gobbled up quickly. It'll light up on the PET scan, and it's not an absolute diagnosis, but that's an area where you probably have cancer developing in an area that uses or eats up the sugar quickly. Cancer cells are very famous for doing that. Now, the first thing is to eliminate added sugar to the diet. Naturally occurring sugars, like in fruit, for example, or certain vegetables or other foods, is not a problem. Nobody has to worry about, I can't eat fruit because it has sugar in it. That's absolute nonsense. This is a food that nature provided, and it provides it with the fiber built into that fruit that helps us to manage and not have a big sugar spike from that food. But this was back in the 1950s. There was a cancer surgeon I believe he was in Omaha, Nebraska, Dr. Quigley. And he was a surgical oncologist, removing cancerous tumors from patients all day. And he found that if the patient changed their diet to eliminate added sugars, this is back in the 50s, it's much worse now, that he didn't have a single case of cancer recurrence. if they change their diet to eliminate sugar and adopt more of a unrefined, unprocessed whole foods diet. And he said if the patient wasn't willing to change their diet, he said at some point they were going to be back for another round of surgery for that recurrence of cancer. So that's sort of a thing. And so sugar is like thing one. That's one thing to keep in mind. And now the other things that we should look at in terms of foods that are problematic, there are several. One of them is genetically modified foods in general, so GMO foods. And the simple way to avoid these is by, as best you can. I mean, it's hard to be 100%. I'm not 100%. But to eat organic foods as much as possible, preferably local foods. So that's a thing, is to reduce chemical exposure. Chemical toxicity, environmental toxicity is a major cause or contributor to cancer, for sure. And, this huge lawsuit that was won by a guy who was a farmer spraying pesticides like glyphosate, and then he developed lymphoma. Bobby Kennedy was his attorney, sued him, and he won like a huge, millions and millions of dollars, because he was able to prove that glyphosate or Roundup exposure caused his cancer. And so that's just one example of how environmental toxicity definitely contributes to cancer. We can best eliminate that by eating foods which are organic and preferably local, but at least organic. Next is in terms of foods that can be problematic. Let's just put it that way.
Can I stop you for a second? I know you're on a flow because I know I can hear voices, even though it's not live. I know. What are some examples of GMO foods?
Yeah, well, that's a great question. The 94% of world soy, so soy foods, are GMO. And it's about that much, about 90% of world corn is GMO. And it's just, we have a messed up subsidy system in our country where farmers will receive money from the government to grow these GMO crops, right? Or these massive, factory farming crops, like corn and soy, for example. And so that, so genetically modified, can be a lot of things, but most commonly, it'll be corn and soy foods. Now, the other problem is they use glyphosate, Roundup, as they spray it on non-GMO crops to dry them out and to prevent spoilage of the grain in the silo. So, for example, most American farms that grow wheat or any grain, oats, rice, any grain crop, just before they harvest it, they'll like soak it with Roundup, which this is horrifying. They'll just soak it with Roundup to dry it out, and as a desiccant. So that way it's lighter, easier to harvest. When they dump it in the silo, when it sits there for some period of time, it might be less likely to spoil. But we're getting this barrage of Roundup, particularly on American crops, that is, horrendous. And again, it's if you just have, one bowl of, the highest Roundup or glyphosate residue of any food is Cheerios. The second is Honey Nut Cheerios, just for example. And that's an oat cereal. And it's not GMO, but they spray it with glyphosate anyway for those reasons. So if you just had, a bowl of Cheerios and that was your, glyphosate intake, that's not going to be a problem. But it's it's just having it a tiny amount in thousands of foods. That is the problem. It's the cumulative exposure. So you have your GMO foods and you can look for organic or non-GMO certified. That's how you fix that. And then you try to find organic grains as best you can, so it hasn't been sprayed with Roundup. Now, is it perfect? No. There's neighboring farms and some can blow over, but it's much better than having your oats that go into your Cheerios get just soaked, absolutely soaked with these crop duster type planes with Roundup. So those are some, big ones, I would say, that are very significant. There's also a concern about artificial sweeteners, things like NutraSweet, Splenda, other, Spartame, other artificial sweeteners. There's a potential increase in cancer risk there. So those are a couple of the things that we want to do to really try to avoid as best we can. And again, it's hard to be perfect. I'm not perfect. I'll go to a restaurant that isn't an organic restaurant. I'll be having some conventional foods that are, maybe have some of the bad stuff in it. But the interesting principle, Leona, is that, and I encourage patients to eat a 90-10 diet, which means if it's 90% clean, 10% can be kind of whatever for most people, because if you have enough of the right thing in your diet, you're able to handle some of the wrong thing and be fine, right? So it's not like you have to be perfect. You just have to be good. And then if you have enough of the good, you can handle a little bit of the bad. And that's the basic idea. So, so you go to a party, eat out, go on a cruise, whatever it is, it's not going to be a, local organic diet.
It's the
But you'll get
exception, not the rule.
Yeah, exactly,
Yeah.
exactly.
Mm-hmm.
So, the problem is, we have 10,000 chemicals that's in our food supply, synthetic chemicals. And in Europe, for example, the number is 400. So there's more than 9,500 chemicals. And you can read about this in a book called The 100-Year Lie, which by Fitzgerald. He talks about this, where we're just in a chemical soup all day. Every time we drink municipal water, eat regular food, shop at the supermarket, breathe the air, we're just bombarded with chemicals all the time that are illegal in most countries or just not used in most countries. There's dozens of food additives that are banned in most advanced countries. So, this is a big problem, that we're just in this chemical soup, and this constant, like a little drip, drip, drip of chemicals. It builds up, it accumulates, and becomes more than we can clear or handle. And that's when we start to see the damage from these chemicals, including cancer. We just have a lot of cancer in this country, and it hasn't been going down. It's been going up. The statistics are startling. There's been hundreds of percent increase, several 100% increase in cancer over the decades. It hasn't gotten better, it's gotten worse. And part of it is the massive amount of sugar. Part of it is the advent of glyphosate and Roundup and genetically modified foods in the 70s and 80s. So now we're like 50 years in to this experiment gone terribly wrong. And people are getting further and further away in our food supply from natural, whole, as minimally processed foods as possible. And unfortunately, a lot of our food assistance programs pay for soda and these super sugary drinks and highly processed foods. So the government is like subsidizing, and some people need food assistance. Great, let's give it to them. But we're giving them really bad food that's going to make it much more likely that they'll be diabetic and have cardiovascular disease and cancer and Alzheimer's disease, which is now acknowledged as type 3 diabetes. It's sugar damage to the brain. It's not amyloid plaque. It's glycation damage. It's sugar damage to the brain. So, these are very preventable things, but unfortunately, we have the sickest population of people in world history, especially the kids, right now in the United States. So if we can get kids started off right, eating, a whole food diet, the payoff as we go along in terms of, reduction in cancer is enormous. So with that, I want to talk a little bit about foods that we can eat that actually increase our cancer resistance. And again, the Yeah, so that's probably good spot to go
Yeah.
next.
Before we
So
do that, because I want
yeah,
to
please,
relate it to the listeners, because I know
absolutely,
people are like, why would they do this to us? Because the reason why I had you list examples of GMOs is
yeah.
because a lot of people are trying to be plant-based and they're doing their Beyond Burgers and
Oh,
Impossible
geez, yeah,
Burgers, which are
disaster, yeah,
practically GMO burgers. They're doing
yeah,
their soy milk and all these things. So I just wanted you
yes,
to really, I want people to make that connection of what's really
yes,
happening.
yes. Yeah, it's very important and again, I mentioned corn and soy. There's also sugar beets and canola and even potatoes, alfalfa. There's even some apples that are GMO. It's kind of messed up. Certain farm salmon. So there's a lot of things that are actual GMO foods. And I really do not. And we'll get into this when we get into the cancer resistance foods. We need in our diet a complete spectrum of healthy fats. And this is a big, misunderstanding in the diet. These beyond and impossible and all this type of stuff. It would be great if it was impossible because then it wouldn't exist. but but unfortunately, these Franken foods are highly processed. It's like ultra processed foods that do much more harm than good. It's a chemical burger, or it's fake food. It's Franken food. It does not belong in the human body at all, and it's much better to eat much more of an omni. We're built as omnivores. The human body is an omnivore body. Our digestive secretions, length of digestive tract, incisors, everything indicates that we are built as omnivores, and we need to have a range of foods, both plant and animal, in our diet to optimize our cancer resistance and other benefits as well. So that's I'm glad you brought that up. So the research is pretty clear. Like we now have a lot of research, and I'm reviewing hundreds of studies every month as part of our courses at the school at michaelgaeta.com. And if folks want to learn more about this, just go to cancercourse.com. We have a very detailed course on this subject with live classes every month and several faculty. Cancercourse.com. And the foods that make us more resistant to cancer, there are several. The first thing is actually to have plenty of saturated fat and cholesterol in the diet. Now, that sounds weird to some people. We've been taught that cholesterol is bad, animal fats are bad, they create inflammation, all this nonsense. But if you're eating adequate cholesterol in your liver and other tissue, every cell in your body makes cholesterol. It actually helps to make our cell membranes stronger. Our cell membranes that surround our cells, the outer wall of our cells, you could say in a way, is made of cholesterol. It's a phospholipid bilayer. So when we have cholesterol deficiency, and this is why folks who have low blood cholesterol, I just had in our functional medicine program, we have a 1-year certification program. We had a patient. We review hundreds of cases with labs over the year, and we just had a patient we reviewed, just a few days ago in our weekly call. And this poor lady already went through thyroid cancer, and her cholesterol is still only 144. It's dangerously low. And so when your cholesterol is low, your genetic material in the nucleus of your cell and the cell membranes of your cell are vulnerable to damage from everything: inflammation, degeneration, toxins, infections, whatever. You do not want to have a deficiency of cholesterol in your body. It's much more. There is really no such thing as high cholesterol. That's another story. Um, People get scared of cholesterol. That was a campaign they cooked up in the 1960s to demonize cholesterol and then get people eating more sugar. And then people are looking for cholesterol-free foods. That means the food is to be avoided, if it's been processed to remove the cholesterol. So eating adequate cholesterol is very important to prevent infection, cancer, genetic damage, all of that. And we need adequate sunlight to convert that, sun exposure without sunscreen. Don't get a sunburn. But for most people, they need more sun exposure so we can convert that super healthy protective cholesterol into a lot of things, like many of our hormones, bile, and vitamin D are made out of cholesterol. So these are very, very important. That's a very important thing. So great health supporting foods like local organic eggs. I recommend people eat generally, most people, at least a dozen local organic eggs per week is a good minimum. And, I've been doing this 35 years, treated many, many, many thousands of patients, and people just reliably feel better. They're like, wow, I just feel better. I feel stronger. I feel more oomph. I feel more robust. And that's part of it. It's not the only thing, but eating adequate eggs and, pastured grass-fed meats, beef and bison, grass-fed, super healthy food. Loads of omega-3, by the way, as opposed to factory farmed, GMO corn and soy fed cows. Grass fed beef is an entirely different food. So, having adequate cholesterol in the diet from eggs and pastured animal foods is super protective and helpful in cancer resistance. Another thing, and the research on this is very, very strong, is cruciferous vegetables. Now, cruciferous vegetables, there's about 21 different ones. This is broccoli and kale and Brussels sprouts, cauliflower, bok choy, radishes, things like that, cabbage, collard greens. All of these cruciferous vegetables, the evidence is irrefutable. There's a direct relationship between cruciferous vegetable intake and cancer incidence. People who eat the most crucifers have the least cancer, period. People eat little or no cruciferous vegetables have a lot more cancer. So that's a very simple thing to do. Another major thing, and the flip of that is in terms of the animal products, is eating like grain-fed, GMO grain-fed beef is not a good idea because you're eating all the residue. You're basically eating GMO corn and soy. When you have like go to McDonald's and get a burger, that you're eating GMO corn and soy that cow ate, that you eat that cow. So that doesn't mean meat is bad. It's a quality issue. So we want to avoid the bad stuff, just like dairy products. If you're eating raw, organic, unpasteurized, unhomogenized A2 milk, that's super healthy for most people. But if you're eating, pasteurized, homogenized, A1, A2, hormone, steroid, antibiotic filled cow milk, the usual milk from the store, that's a big problem. So that's an example. It's a food quality issue. You don't want to say meat is bad, meat is good. It depends on the meat. You don't want to say dairy is good, dairy is bad. It depends on the dairy. It's a quality issue. And same thing with grains. If you're eating white rice that's been bleached and chlorinated and all of this, or similar compounds, that's a problem. If you're eating, organic, ideally short grain brown rice, that's a health food. So it's a food quality issue that's very significant. Just like sweeteners, right? Raw honey is something everybody should eat. It's a health food. It's a protective, wonderful food. Compare that to high fructose corn syrup. It still has sugar, but it's much more likely to kill you than raw honey, which can help you be healthier, right? So food quality is really what I'm talking about here, right? It's not that all sugar is good, all sugar is bad. What's the source? Is it raw honey or raw maple or organic maple syrup, or is it high fructose corn syrup? Huge difference. So these are the things. And then all of the seed oils, the corn, safflower, sunflower, soy, these seed oils are very inflammatory, very problematic, a lot of GMO, a lot of Roundup, a lot of glyphosate. The seed oils ideally would be avoided in favor of healthy fats like butter, bacon fat, beef tallow, coconut oil, olive oil. These are healthy fat. Avocado, those are healthy fats. The seed oils really should be avoided. And when in doubt, don't forget butter and better are almost the same word. And that's an easy way to remember, but organic Grass-fed butter is a wonderful health food, that people should enjoy. Other things in the diet, if we have a little time, that increase cancer resistance. A wonderful thing is green tea. I have my organic matcha,
Mm-hmm.
1 or 2 teaspoons, have a day, of organic matcha tea. It's not expensive, and that can increase. There's one study that suggests that folks who drink green tea every day have a 50% reduction in cancer risk, which is astounding. Like a one simple thing. It's not a guarantee. So people who eat great and exercise still get cancer, but we're talking about minimizing risk and maximizing positive outcomes. So green tea, simple dietary thing. I mentioned cruciferous vegetables as well. My recommendation is try to eat one cruciferous vegetable per day, 5 days a week. So even if it's not every day, but at least 5 days a week, pick one crucifer that you like and go eat it. Also, wonderful food, and you don't have to be of Italian descent like me to eat garlic. Garlic, even the National Institutes of Health research confirms that garlic increases cancer resistance. So eating garlic in your diet is a wonderful thing. As I mentioned, healthy fats like wild fish. One of the best things you can do to reduce inflammation, increase cancer risk is wild, not farmed fish 4 or 5 times a week. Omega-3 status is very significant. It should be evaluated. Folks can go to michaelgaeta.com/store. And our store page, you'll see a test that everybody should do for your omega-3 status. You can dramatically reduce your risk of cardiovascular disease, sudden cardiac death, cancer, and many other conditions, Alzheimer's, brain issues, cognitive problems, just by optimizing your omega-3 status. Very significant. And also in the diet, turmeric. That's the main ingredient in curry. Folks in India, 1.4 billion people in India, and their average national intake of turmeric is 2 grams a day, just in their diet. 2,000 milligrams a day of turmeric just in their diet. And that 2 studies have come out suggesting that might be why more people in India per capita smoke cigarettes, but they have less lung cancer per capita than in the United States. And they're theorizing, well, one might be because our cigarettes have a lot more crap in them, a lot more bad chemicals in them than other cigarettes do in other parts of the world. That might be a factor. But just like wheat, people get afraid of wheat and gluten, where a lot of the time the problem isn't the wheat or gluten at all. It's the glyphosate that wheat has been soaked with, similar with our cigarettes. So it's either the cigarette, American cigarettes may have more bad stuff in them, toxic chemicals, or it could be that they're eating 2 grams of turmeric a day on average. Also, other foods that increase your cancer resistance is organic fruit. Half cup a day of berries, mixed berries or whatever berries you like are fabulous. So organic foods, including berries, that's part of the dirty dozen there. When they're not organic, the pesticide, herbicide content can be pretty significant. So organic's real important. And then a major companion food to cholesterol, which is good, protective. And by the way, there was a European study that showed an increase in cancer risk the lower your cholesterol, total blood cholesterol was below 230, and the more your LDL cholesterol was below 130. So they actually found that 230 was a minimum total cholesterol in the blood, LDL 130 minimum, that type cholesterol in the blood to minimize your cancer risk. So cholesterol is protective, as are saturated fats. So the companion to cholesterol is sulfur. Sulfur foods, having natural sulfur in the diet, is very helpful. And then your body can create something on its own called cholesterol sulfate, which is very protective. It reduces cancer ability to metastasize. It helps to prevent mitochondrial damage. And the theory of cancer that I teach is that the genetic damage of cancer isn't the primary cause. There's a cause of that cause, which is mitochondrial dysfunction, mitochondrial damage, metabolic dysfunction, which has a lot to do with insulin resistance, high sugar, and other problems. So when we eat sulfur foods like garlic, onions, and eggs, those are wonderfully protective to help protect the body from cancer and other conditions. So that's a very useful thing. And I'm steering clear of supplements and herbs. I talk about that a lot, but we're going to stick with foods today. So these are very useful things like in the diet that can really increase our cancer resistance.
So good. And I'm glad you brought up the cholesterol thing because I've seen more problems with low cholesterol than high
Yes,
cholesterol.
me
And
and you
my
both.
cholesterol's pretty high. And then when you said that 230, I was like, yes.
Well, it's a great point, Leona. Before the first statin came out in 1987, that was Merck's Mevacor, and average unmedicated cholesterol in the United States is 220. So Mevacor comes out in 1987. It's a Merck drug, and nobody needed it. So and at that time, in 1984, I have the textbook from 1984, before the statins came out. Upper limit of blood cholesterol was stratified according to age. So as we age, our blood cholesterol levels should go up. Why? Because cholesterol is protective. And as we age, we need more protection. Therefore, we need more cholesterol. And so at age 59, in the medical textbooks, used in every medical school, in the 80s, and for decades before that, upper limit of cholesterol at age 59 and older was 330. That was normal cholesterol at age 59 plus. It was 330. And then it went down with declining age in terms of upper limit. And the main way they assessed cardiovascular risk, like what's your risk of heart attack and stroke, was looking at the amount of protein in your urine. So total urinary proteins and urinary albumin was a very reliable, very validated, with hundreds of, at least dozens of studies. This is a well-validated marker for cardiovascular risk. That's how they looked at it, urinary proteins. And when the statins came out, nobody needed them, right? Because average cholesterol was 220, upper limit 330 at age 59 and up. And so what did they do? They just started making stuff up and created this fear campaign. The cholesterol is bad. And they lowered the upper limit of cholesterol to 200. Why did they pick 200? Because it was below the national unmedicated average. And then they created these fake cholesterol targets which you can't achieve without drugs. Because diet can change cholesterol levels a bit, but not a lot. 80% of the cholesterol in your body comes from your liver, but every animal cell and every animal species makes cholesterol. So they had to really do this like crazy fear campaign that there was something bad about cholesterol in your diet and something bad about cholesterol in your blood, that you needed to do something to get the number down, which is a complete lie. There's people who have heart attacks and strokes have the same cholesterol in their blood as people who don't. There's very little difference between cholesterol levels in people who have heart attacks and strokes and people who don't. It's not the issue. There's other things. And I encourage folks to go to cardiocourse.com. Cardiocourse.com is a great course where we talk about this. We have several faculty, physicians, scientists, all kinds of stuff where you learn about this. We spend hours just on this one cholesterol topic, and then have live monthly classes for Q&A and research. So this cholesterol thing has been totally blown out of proportion. And now some labs, and I'm sure you've seen this in your practice, have an upper limit of cholesterol of 169. They're just making stuff up because it sells more drugs that don't work and can cause an enormous amount of harm. If you look at the side effects from these statin drugs, they're catastrophic. And the outcomes are not there. It's really a scam. It's a myth. It's a hoax that cholesterol is the enemy. It's just not true. And a massive study came out in 2014 proving absolutely, we've been saying this for decades in the holistic field, but finally this massive study came out end of 2013, early 2014, that with 500,000 patients tracked over decades, and they finally had to admit what folks like me had been saying for years, which was that the cholesterol in your diet, the cholesterol that you eat, is irrelevant. The amount of saturated fat in your diet that you eat is irrelevant. Dietary fat, dietary cholesterol mean nothing. And the problem with this is that we've starved our cells and our DNA and our nucleoproteins and our nucleus of the cell. We've starved our cells of protection, right? It's like, you when you get rid of the police force, the criminals go crazy because there's nobody to keep them in check. Well, there's no cholesterol in your cells to protect your cells from damage from this onslaught of environmental toxins. So we've actually added to the cancer epidemic, I would say, because it keeps going up in incidence. We've added to it with this like cholesterol and saturated fat phobia that has really done a lot of damage. And so I really encourage people to just ignore all that stuff and just eat. Again, it's a food quality issue, right? I'm not suggesting eat McDonald's all day. I'm not suggesting that. I am suggesting try to find local, if possible, grass-fed, organic, pastured, meats and eggs. So that's that, and then you'll be much better protected against the genetic damage of cancer.
Right. Oh my goodness. This is what I've been saying all along as well. And I know people are listening, and I think what's hard for a lot of the listeners is, why would they do this? Why would they lie to us? Why would
Oh, it's
they,
easy.
you know?
Yeah, it's easy. But for example, you get a patient on a statin drug, say a postmenopausal female on a statin drug for 5 years, her risk of diabetes goes up 48%. I'm going to say that again. This is right out of the literature. If you are a postmenopausal female on a statin drug for 5 years, your cholesterol risk goes up 48%. That's awesome if you're a drug company, right? Because then you need drugs to manage your blood sugar, right? Caused by the statin, right? And overall risk of diabetes goes up. One study, anybody taking a statin for at least 5 years increases your cancer risk up to 45%, which is awesome if you're a drug company, right? It causes neurological damage, brain or neurological or muscle damage in 10% of the patient. Well, actually, 10% get muscle damage, 10% get brain and neurological damage. And the list goes on, loss of libido, sexual function, everything tanks when you're on a statin. Everything gets worse, and the benefit is zero to very, very slight benefits. So that's why this is all happening. If you feed people bad foods, then they get more diseases that require drugs to manage. And that is why this is all happening. It's one big mess, is that the food industry is creating the big food, big ag, whatever you want to call it. The food industry is making business for the drug industry. And that's what's happening. And I think the insurance industry profits off of all of that, especially the drug side. This is a big issue. So if we just get to the causes, get a half hour of exercise a day, 3 to 4 hours a week, eat local, as best you can, local organic foods, unprocessed, unrefined foods, not from a package or a can if possible. Although, canned wild fish is fine. Something like, what is it? Natural Catch is they have natural sardines, tuna, and mackerel, just as an example. So it's easy to get those 4 to 5 servings of wild fish every week. Very easy. So simple things. Get some exercise, get out in the sun, stop eating highly processed sugary foods, eat organic and local as much as possible. Your cancer risk is going to be decreased like 90%, perhaps. According to the data, you can massively, it doesn't mean it's a guarantee, because healthy people still get cancer. And there's EMF and electromagnetic fields and a lot of other factors 5G, that might be contributors as well. So there's other lifestyle factors, stress, grievances, anger, frustration, all kinds of things. There's a whole mind-body component we won't get into today. But if you just do these simple things, your cancer resistance goes up, your quality of life goes up. You just feel better. You have more energy, you feel better, you're not as sick, you're not as tired. you have more vim and vigor, and you're able to, bring more of who you are into the world and blessing and contribution to others. So, these are not complicated things, but we just have to remember that diet causes cancer, just as diet can prevent cancer. That's kind of the main message today. And if we just get back to basics, this is not complicated stuff. And organic foods are not massive. It's about 14% higher cost overall of organic to conventional food. So it's not like triple. It still does cost a little more, but you get what you pay for, right? You can eat cheap at McDonald's, but it'll kill you, right? You can eat Doritos every day; it'll kill you. If that's all you have is Doritos and Diet Coke. It's going to mess you up. So yeah, it costs a little more, but not a lot more, and it's your health. As I said, as we started out, you can pay the farmer now or the doctor later, and that's not a fun proposition because you might be, paying for medical care to treat cancer or a heart attack or a stroke or something else. So if we have whole foods in our diet, and optimally supplements that are also food-based, not synthetic, it's a whole other discussion. This is very easily done because we do need supplementation to bridge that gap between what we eat and what we need. So you got to, because we live with all the environmental toxicity, radiation exposure, stress, illness, all these things massively increase our nutrient demands. So we talked about the foundation today. And then we just need to figure out, correct food-based, non-synthetic supplementation. So it's simple stuff, but it really makes a difference. We have all the research now. It's like very easy. It's very clear. We know the foods that increase cancer risk and the foods that increase cancer resistance. And we talked about a lot of those today.
And you said a key thing, it's the foundation. You know how many people I get?
Totally.
I learned I had cancer. What do I take? What
Yep.
supplement? At the end of
Well,
the
that's
day,
another
no matter
discussion
what you do, because we can go on and talk about all these different therapies,
for sure.
but you
Yeah.
gotta have that foundational diet.
Yep.
Even if you're taking supplements and getting these vitamin C injections or whatever's
Well,
out
that's
there,
synthetic. Yeah.
you still
Those are
have to
drugs.
have a good foundational diet, and that's
You
so
do.
important.
You
Yes.
do. Oh, and one more food is super helpful for cancer patients and also folks who just want to increase their cancer resistance is wheatgrass juice.
Oh, yeah.
Ann Wigmore founded the Hippocrates Institute. She was, I think, 64 years old, 62, but near the average age of diagnosis of cancer, 67. 67. She's about that age. She had multiple metastatic cancer all over her body. They're like, we can't treat you. You got a month or two to live. Get your affairs in order. It's basically prepare to die. We can't treat you. This is, decades ago. And like most cancer survivors, she was very feisty. And, as the story goes, she said, never, I will outlive you all. And she did. She cured herself of cancer. She lived another 30 years, died as, so-called natural causes or something else. And she attributes part of her recovery from cancer to drinking fresh wheatgrass juice every day. So if you go to our store page, we have a link where you can get all the kit and organic wheat berries, and you grow wheatgrass on your windowsill. Get a juicer specifically for wheatgrass, and for prevention, folks can just have maybe an ounce a day. That will give you 2.5 pounds of vegetables worth of nutrition in that 1 ounce of fresh wheatgrass juice. And for cancer patients, I typically recommend they gradually work up to more than that, maybe 4 to 6 ounces a day. So that's a very powerful superfood that can really, really help your diet and your cancer resistance. And the last one I would mention is fermented foods.
Yes.
Very helpful. They look after the microbiome, which has an enormous impact on our immune function and inflammation and leaky gut and other factors, which we don't have time for. But having, I recommend a tablespoon of organic apple cider vinegar a day and some water, and then one other fermented food of your choice, per day. And there's a book called Wild Fermentation, How to Make Your Own Fermented Foods. Super easy, very, very simple. It doesn't take much. You just need like a jar and water and maybe a culture or something. Super simple. And but daily fermented foods, at least that little bit of apple cider vinegar, maybe some sauerkraut, whatever you like, can really make a difference to look after the health of the gut microbiome. That's a big subject, but an important one. But that's a simple thing people can do to increase their overall health as well as their cancer resistance.
Yeah, you just helped me think of my next summit. Like
Oh yeah.
ancient traditions, because you brought it back. Because when I started this work 20 years ago, Weston Price,
Yes, exactly.
Sally Fallon, Ann
Hmm.
Whitmore. Oh my gosh,
Absolutely. No,
way
these are the
back.
greats. These are the
Yeah.
greats. And what they've taught, is very, very helpful for this subject of like how do we do what we can do, to prevent cancer because it's preventable. And if you do have cancer, I do recommend consulting, somebody like me, to get on a personalized program of diet supplementation, herbal medicine, other, devices can be helpful. Lots of things can be useful. So yeah, so for the listeners, folks can go to our michaelgaeta.com. They can click on courses. We have 58 courses on natural health, including cancer, cardiovascular, autoimmune, other things. And happy to do a consultation for folks who may want to come to the clinic wherever they live for a health consultation.
Oh, thank you so much for that. I'll make sure I'll have that in the information on your speaker page so they can
Yeah,
get that
sure, sure.
information because we can go on and on and
We
on,
sure
on
can.
with this. There's
We
so
sure
many
can.
levels. There's no simple answer to this, but I'll definitely have that information for them to reach out because I know people are going to they're going to want to learn more. You just really piqued their appetite on this.
Yeah, yeah. And
But,
we talked about this in the Monday podcast, 1 p.m.
oh,
Eastern
okay.
time. Every Monday, we just had our 248th show. And so we're
Congratulations.
together. And it's all about natural health and health freedom
All
on the
right.
Monday podcast, Mondays with Michael.
Well, I'll definitely be checking that out myself because, I'm always learning and trying to understand this so we can help other people.
Well, why
Because,
don't you come on as a guest on the podcast? I'd love to interview you and return the favor.
oh, I'd love to. Love to do
It'd be
that.
great.
Let's do
Have
it.
another
You hear
have
that?
another
You heard
conversation.
that? But yeah, we're going to see more of Dr. Gaeta and you're going to see more of me. But we got to get this message out there. I mean, it's
Yes.
just
Yes.
not spoken enough. And too many
Yep.
people are getting cancer. And like I said, we're dedicating this to your mentor and my mom
Yes.
and all the other ones out there that are really struggling with this disease. But at the end of the day, understand that cancer is a metabolic disease,
It is.
and these strategies can help with diabetes, it can help with heart disease. So it's just
Yes.
absolutely phenomenal. So thank you once again, Dr. Gaeta, for this amazing information. And thank you for joining everyone. And let us know what you think. Send your comments and questions to me. And I'll make sure he gets them. Again, he's going to have his contact information in his
Yep.
speaker form.
MichaelGator.com.
So
Yep.
you're going to get everything you need. So once again, thank you for joining. Let me know what you think of this interview. And until next time, y'all be healthy and go out there and achieve more freedom in your health and your life. Take care,
Hmm.
everyone. What an incredible conversation. Dr. Gaeta just broke down some of the biggest misconceptions about cancer and provided real actionable strategies for preventing and managing this disease naturally. So here are some key takeaways from our session. Cancer is a metabolic disease, not just a genetic one, meaning you have more control than you think. Your diet, environment, and stress levels play a crucial role in either fueling or fighting cancer. And simple changes like eliminating sugar, avoiding GMOs, and increasing cancer fighting foods can dramatically shift your health trajectory. As you can see, Dr. Gaeta has an incredible wealth of knowledge. And if you want to dive deeper, make sure you check out his resources at michaelgaeta.com and also check out his cancer course at cancercourse.com. Thank you to all who are watching. Don't forget to let me know your biggest takeaway. And until next time, take charge of your health, make informed choices, and continue striving for more freedom in your health and your life. Take care. Thank you for listening to today's episode. If you enjoyed the show, seal the deal to heal by leaving a review, subscribing to the podcast, and sharing with a friend. Thanks again, and we'll continue the journey next week.